So if a patient has really bad teeth, bleeding gums, bad breath, loose teeth, you cannot save them. It's already been determined they all have to come out.
Okay.
What's the process like when it comes to dental implants in your practice for that group?
Okay, and it's important that you mention, so there's beyond repair, right? So the teeth gotta go due to infection, cavities, whatever. So they need to go, assuming that. So then we can go with 2 implants in the front.
Okay.
That will be the initial step if they choose to do so.
So you extract the teeth.
Extract the teeth, graft whatever needs to be grafted, and then you place 2 implants and you have a snap in, snap out teeth, full set of teeth, right?
All right.
The next step over will be 4, the same process. Take the teeth out, graft wherever needs.
4 implants.
4 implants, and you snap in and snap out. They're way more stable, but still you have to do the maintenance that requires. Once a year, sometimes twice a year, you have to replace the attachments, the snappers, if you will.
So cash out of pocket, you have to pay it once a year probably to get it maintained.
Yeah, once a year you have to maintain that. So you have to take into consideration, plus the hygiene appointments, etc., because you need to clean those implants, right?
Okay.
You have to brush them. So it's not like you have implants and you forget about them. So you gotta maintain them. Now, the next step over, which most of people like it, is the fixed restoration. So they do not come out. So it's anywhere from 4 to 8 implants, depending on the case. And I do with porcelain teeth. I do not do with plastic anymore, like we do with the snap-on and snap-in. And most of the people, to be honest, they still do with plastic teeth. So I don't do it. I used to do it. There's way better technology.
So like porcelains or zirconia or whatever.
Yeah, so that, and there's new materials always. So, and the maintenance there is virtually zero. Okay, so
like getting your teeth back.
Basically, yes. You have to do the hygiene appointments. You have to brush them. You have to floss them, etc. It's the same care.
Yeah. What about the upper? Because the upper is pretty good because there's suction with a denture.
Correct. That's a great point, because when you have the fixed restoration, you don't have anything covering the roof of your mouth. You don't have anything between your lips and your gums. So it's just basically coming straight from your implant. So it's a lot more, you don't feel like you have a mouth full anymore. You can taste food. You can taste your I don't know if you're a drink whiner or whatever, but you can taste it, the spices that is in the food.
The roof of the mouth isn't covered.
No.
Let me ask you this though. If you have bad gums, like gum disease, you can still get a dental implant? Aren't the gums too bad to get this done?
No, once you take the tooth out or the teeth out, the gums becomes healthy. If you do it properly, the gums becomes healthy again, and then you're able to place.
Because what? The bacterial infection has nothing to live on, or?
Right, because the source of that infection in that case was a bad tooth. So the tooth was infecting the gum and the bone. So once you take that source out, then the gum heals itself, and then you can place the implant.
And then the maintenance on this kind of a thing, just like every 6 months, just like a regular person?
You do, yes, you do every 6 months the hygiene appointments. Sometimes, depending on your history, and it's case by case, we recommend every 4 months, just to make sure you're maintaining it right? We want to make sure that treatment will last you possibly a lifetime. So we need to be careful with the hygiene appointments and your home care, yes.
And you said you could be like in your 90s and get this done. So it doesn't matter how old you are. The implants aren't more likely to fall out if you're 90?
No, there's no relationship. Bone is very, in a way, they don't care about age unless you have a severe osteoporosis, which is rare, by the way. And osteoporosis in the mouth is the last to be affected. So we're fortunate enough that we can, age is not an
So
issue.
No more dentures.
Please, no more dentures.
My original dentist indicated that my teeth were deteriorating just so rapidly. He didn't really know what to do or where to go or anything like that. And he pretty much thought I was on maybe some type of drug, I think he said methamphetamine, I can't even think of the name of it now, a drug there that would cause your teeth, to decay rapidly. Dr. Macedo took a really, really bad situation with my mouth, and it was really bad. I knew it after speaking with Dr. Ford, and just really brought back a smile that was just incredible. I mean, from the start of the process, he explained the process to me. He explained what was going to take place, the cost that involved, and through that process, he has brought back this wonderful smile that I have. Really changed my life because I love to smile. I love to talk to people. Now I don't have to do a half smile or anything like that to cover up my teeth. So I certainly would recommend Dr. Macedo to anyone that really want to make a difference in their smile as well as in their life and just really be happy about the work that he's done.